Sweet, let's go ahead and get started. So, in case you missed part one, hi, I'm Sam Gardner. I'm a recent graduate from UW-Madison, and I've been working with Parker Schwab, a current PGY4 psychiatry resident, and his advisor, David Morrison, to put together a curriculum on organizational and occupational psychiatry. And this is part two. So before we get into the presentation, again, it's just important to disclose that we don't have any conflicts of interest or any financial disclosures. And also as a reminder, I'll be using the term org psych throughout this presentation, and it'll be used to encompass both organizational psychiatry as well as organizational psychology. And there is a lot of overlap between these fields, but it's important to remember that they are two distinct entities. And so in part two, I'm going to be getting into why org psych matters. Why is it relevant? Why should you care about it? And so in part one, I established or touched on that org psych really has implications for the vast majority of people in the workplace. Inevitably, work plays some role in your mental health. And just to back this up, we have some stats from the US Surgeon General. So at least 76% of US workers reported at least one mental health symptom. 84% of US workers reported that workplace conditions contributed to at least one mental health symptom. And 81% of US workers reported that in the future, they will be looking for workplaces that support employee mental health. So we've established that work has an effect on mental health, but why is this? What are the factors contributing to that? I think largely it boils down to the fact that work is central to your identity. Right? It has an effect on your mental well-being, whether positive or negative. It has an effect on your family well-being, your social well-being, and of course, your economic well-being. And so how is this? In terms of the social aspects, work places you in a social contract, right? It forces regular interaction with others, and creates the possibility of forming strong interpersonal relationships, right? Many people become close friends with the people they work with. It gives you structure, and it can help shape your day and organize the rest of your daily tasks, giving you a bit of direction and purpose. It can allow for expression of aggression, not just in like the negative sense, but in the sense of going out and acting on the world. And it can also help to escape unstable home life. And kind of in line with the social contract, work can create a sense of community and belonging beyond just family and friends, right? It can be meaningful and fulfilling to feel like you're working with others towards a collective effort. And of course, it contributes to social identity. For many people, what they do is pretty central to who they feel like they are. So it's important for social placement, can help you find partners, whether these are just platonic or romantic, and it contributes to your sense of self-worth. And at the bottom of the screen, we have a quote attributed to Freud. He said, "To be healthy is to work and to love." And so we've established that work is influential in mental health, but what are some of the kind of explicit benefits of work, right? Of course, it's associated with better financial status, working, earning money, but it's also associated with improved physical health. It's associated with increased confidence and self-efficacy. It gives you structure and routine to your life. It can help you find feelings of satisfaction and accomplishment. It contributes to identity and sense of belonging. And of course, it can be a pillar for meaningful relationships. And in instances where employees were away from work, whether unemployed or on a leave of absence for something such as disability, return to work within 6 months has been associated with lower rates of anxiety and lower rates of depression. So it's kind of an explicit effect, positive effect on mental health. And then on the flip side of this, what are some of the adverse consequences associated with unemployment? It's correlated with greater morbidity, increased prevalence of psychological problems. It's associated with loss of self-esteem and identity. It can lead to learned helplessness, result in family issues and tensions. It actually increases your risk of developing new health conditions by 83%, and it can lead to premature aging. So while sometimes it seems like it'd be nice to be unemployed, there are a lot of negatives that go with it. And then on top of all of this, unemployment is associated with increased hospitalization due to alcohol, which sees a 20% increase in men and a 40% increase in women. Increased prevalence of traffic accidents, which increased by 40%, and increased rates of self-harm, which increased by 25%. So evidently, there are a number of adverse consequences that go with unemployment. And so the last two slides, we established why working is good and why not working is bad. But of course, it's not as black and white as that, right? There are times where work can be taxing on your mental health, or can be not just taxing, but detrimental to your mental health. And so a prime example of this is burnout in healthcare. So burnout is defined as some combination of depersonalization, emotional exhaustion, and feelings of low accomplishment. And in 2021, 39% of physicians experienced some degree of depersonalization, 27% reported emotional exhaustion, and 44% reported feelings of low accomplishment. And so large contributors to this are excessive medical documentation, as well as complexities in the medical record. It's also worth mentioning that women are at a 56% greater risk of burnout than men, and minority and ethnic groups are at a decreased risk of burnout. And so we've established that burnout is a problem, but what contributes to burnout, right? And I think it can be boiled down to a sense of lack of control over the environment. And this is associated with, increased rates of unprofessional behaviors, reduced motivation, and suboptimal communication with patients. And kind of underlying all of this, the greatest risk factor for burnout in physicians is chronic insufficient sleep. 40% of attending physicians report that they are chronically not getting enough sleep, and 51% of house staff. Right. And so this contributes to burnout, but it also results in a 96% increased chance of self-reported medical errors, and increases rates of patient complaints. So obviously not a good thing. So what can be done to fight this, right? So as I mentioned, burnout can often be associated with a sense of lack of control. And so doing some things to restore that sense of control can help to combat burnout and, increase perspective and purpose. So some ways to do this are through flexible work and vacation schedules, right? This is giving a little more control to workers, giving them a little more autonomy in when and how they work. It can be done through things such as peer support groups, fostering community and a feeling of belonging can go a long way towards combating burnout. Or it can be combated through things such as mentorship opportunities, which can, help to give a stronger sense of meaning and purpose. And of course, in recent years, COVID just drastically accelerated the rates of burnout in healthcare. And this is largely because the COVID pandemic created an environment where it was extremely high effort, high risk, and relatively low reward. And as a result, this increased emotional and physical exhaustion. It led to feelings of helplessness and lack, or futility and lack of meaning. And many reported feelings of poor employer support, which altogether resulted in more physicians leaving medicine. So obviously burnout is a bad thing. And so here are, I guess, some more ways that burnout can be combated. And this is kind of from a bigger view at the organizational level. So many organizations are kind of reframing their focus, shifting their mission, deprioritizing shareholder value and emphasizing stakeholder value, which considers employees, shareholders, I guess, of course, but also the environment and society as a large. And part of this could be through creating new positions, such as a chief sustainability officer, or increased reporting of environmental, social, and governance metrics, which allows organizations to just better keep a pulse on the feelings of their employees, and more impacts aside from just profit and revenue. And so, of course, leadership also plays a role in combating burnout, and strong supportive leadership is associated with decreased levels of burnout. And leaders who practice mentally well habits themselves are associated with increased wellness in employees. And so um, and many leaders are adopting wellness-centered leadership principles. And so these are kind of based on three main tenets: care about people always, be empathetic, listen to your employees, be a part of the team, recognize difficulties, show appreciation. Another pillar is cultivate individual and team relationships. As I mentioned earlier, developing a sense of community and connectedness can go a long way towards combating burnout. And then the last pillar is inspire change. And so in WCL organizations, there is more of a reliance on intrinsic motivators rather than the carrot and stick model. And so these can be things such as input and feedback from employees, cultivating, a sense of meaning, purpose, giving employees more control and more autonomy in their work, and then focusing on growth and values. And this is in contrast to carrot and stick motivators, such as high patient throughput, focus on RVUs or relative value units, focus on cultivating competition, and the threat of punishment. And so to wrap this section up, just some guidelines for healthcare leaders when considering burnout and trying to combat burnout. It's important to remember that the need for meaning is core to human psychology, right? Meaning and purpose and drive are all important in combating burnout, and failure to recognize this can increase burnout. And then drive for meaning can often be stronger than the drive to avoid for pain. And this kind of goes hand in hand with the first bullet. Having a strong sense of purpose, a strong sense of motivation and meaning in the work that you do can help you get through challenging situations or difficult times, and suffering can be meaningful. And then it's also important to remember that meaning is individual, right? This manifests differently for everyone. What motivates someone to do the work that they do might be different for each employee. And so it's up to leaders to inspire and guide towards meaning. And part of this is publicly acknowledging the difficulties of the job and empathizing with employees. And then lastly, it's important to express genuine appreciation, admiration, and recognition. And of course, this must be self-aware. So we give a quick example, and that's that if you wanted to show support for your ICU team, you might want to do something like send them pizzas, right? But we say go a step further than this. Don't just send them pizzas, say good job. Actually, maybe take the pizzas down, or at least go down and, visit with the employees, be there, be a part of the team, listen to them, hear about their difficulties, hear about their successes. And just, it goes a long way to combating burnout. And so we'll kind of shift tracks now. We've covered why work is important, some of the benefits of work, some of the risks of not working, some difficulties that can come with working and impacts on mental health. And so, we've established that work inevitably has a large effect on mental health. But as I mentioned earlier in this presentation, there's, a relative lack of training programs in residency. So we have some stats from the group of advancement of psychiatry that just kind of reflect this. They surveyed a bunch of residency programs. They found that 98% of psych residents very strongly, or at least moderately, believe that psychiatry and work are related, right? So that's essentially everyone. But only 15% of residency programs actually offered formal training in work psychiatry. 80% of psych residents very strongly or moderately believed that residency curriculum should include work psychiatry, and only 25% reported that they were moderately or very comfortable with determining accommodations for work. So this just highlights kind of the discrepancy between the applicability and utility of org psych with the relative availability of formal training. So that's part of our hope with this presentation, is to, share a little bit of knowledge and hopefully maybe inspire a little bit of change and, increase prevalence of training programs. And so, we've covered a lot of why org psych matters. And of course, I think it's pretty evident that providing resources to help support employee mental health is a good thing. But a reality for organizational psychiatrists is that they're working with businesses. And so, the concepts of financial viability and revenue and profit and all of those things play a role. So in this section, we're going to be looking a little bit at the financial viability of implementing org psych and some of the social and economic costs of mental health disorders on the workplace. So we'll start with the costs. It was estimated that in 2020, the net costs and losses due to major depressive disorders was $326 billion. This number was $83.1 billion in 2000, and in 1998, 63.1 was lost due to anxiety disorders. And so the reason I give kind of these two contrasting times is to show that there's been a growth in this number, and this growth has outpaced inflation, and it's due to rise in work and treatment costs. So when we actually get into looking at what's comprising these net costs and losses, there's two things to consider. There's direct costs, which comprises things such as treatment or intervention for employees with mental health disorders. And so this is things like, these are things like pharmacotherapy or psychotherapy. And in the year 2000, it was estimated that these totaled to a cost of $26.1 billion. And so that 26.1 makes up part of the 83.1, but you can see it's a relatively small proportion. So where are the rest of those costs or losses coming from? And these come from indirect costs or losses. So these are things such as absenteeism or presenteeism. And if you're not familiar with the terms, absenteeism is just a greater number of missed workdays associated with mental health disorders. And presenteeism is a reduced degree of productivity while at work associated with mental health disorders. So in MDD, both of these are 2 to 3 times higher. MDD was also associated with a 20% performance decrease in physical tasks and a 35% decrease in mental or interpersonal tasks. And in 2020, the mean presenteeism cost due to MDD was just over $5,000 per employee. So I think this makes it evident that there are substantial costs and losses due to mental health issues in the workplace. So on the flip side of this, what do employers actually stand to gain by strongly investing in programs for employee mental health? And so in terms of health savings, MDD remission was associated with a 5% decrease in non-psych outpatient visits and an 85% decrease in the number of hospital days. And panic disorder treatment was associated with a 94% decrease in non-psych healthcare utilization. So you can see that treatment or intervention for mental health disorders goes beyond just the usage of healthcare resources like for those specific disorders. It also decreases just in general healthcare utilization. And in terms of productivity savings, 1 year of MDD treatment resulted in a 25% chance increase of finding or maintaining a job and a 66% decrease in the number of missed workdays. And so the decrease in the number of missed workdays alone is enough to fully offset the direct costs of treatment. And then this, of course, isn't even accounting for the additional savings due to the decrease in presenteeism. And so strong investment goes beyond, it fully covers the costs of treatment and actually creates more value for organizations. And so some studies have shown that there is a return of $4 for every dollar invested in mental health treatment or intervention. And I think this stat is really exciting because it's showing that not only are, org psych principles, not only are they financially viable, it's a financially smart decision, right? It clearly benefits employees, but there's also really strong financial incentives for organizations. And so my hope is that, sharing this knowledge, or at least just this knowledge being out there, means that org psych will kind of spread and become more prevalent across the board. And so that wraps up this section. Thank you so much, and I'll see you in the next one.